Bovine Colostrum. Now I want to make some common sense about why colostrum is the only treatment that is viable for leaky gut. When all mammals are born, that doesn't matter whether it's mice, a whale, or men, we are all born with holes in our gut. And this is purposeful. The holes in our gut are to allow colostrum to pass into our bloodstream and provide a passive immune transfer. One of the things that we have ignored and overlooked, and I have New Zealand friends and done a lot of business in New Zealand over the years, is they talk about the fact that we townies, in other words, the people that grew up and are raised in the towns instead of on the farm and in the ranches, have no knowledge of our connection to the colostrum is so vital. People that are raised on a ranch know that if the colostrum is not present and the animal doesn't receive the colostrum transfer through suckling, within 24 hours that animal will die. Humans are the only ones that will survive not obtaining colostrum from our mother. One of the things that we don't understand also about colostrum is that historically, colostrum has been ingested and used in human societies all the way through recorded history. In Ayurvedic medicine, the cow was created a deity. In other words, we turned the cow into a god in India because it provided the most powerful immunological substances in the world. The cow has an ability, and it was the first domestic animal, not the dog, our beloved dogs, we love them, but the cow was a walking food store. We could milk the cow, we didn't have to kill it to get food. But one thing that we didn't understand until recently is that the cow can produce active antibodies to every pathogen that crosses its path within 24 hours. And so all of society, from the cow tribes in Africa to Europeans, make a pudding with the colostrum. Colostrum from cows in India has been delivered by the milkman for over 4,000 years and is revered for its ability to pass on that immunity to disease and pass on and heal the gut and provide the growth factors that stimulate the growth of all of the tissue within our body. We see a lot of regular use of bovine colostrum brings a wide spectrum of anti-aging benefits in addition to healing and preventing leaky gut. We get bone growth and density because colostrum contains bone growth hormones. And so taking on a colostrum on a regular basis will help prevent osteoporosis. Muscle growth and support because colostrum has all of the growth factors including IGF-1, which is the real growth hormone. And only bovine colostrum provides all of the growth factors, including the transforming growth factors that are involved with bone growth and involved in cancer cell destruction. It's an anti-cancer defense because it brings a balancing and a modulation effect to the immune system that's more powerful than any other naturally occurring substance. Colostrum increases insulin sensitivity so we can reduce insulin needs in type 1 and type 2 diabetics. Colostrum has anti-inflammatory protection. The peptides that are involved in colostrum have the ability to reduce and eliminate infection. Colostrum taken along with the peptides that are in colostrum on a regular basis will help eliminate pain and eliminate the need for pain medications, which are a direct cause of leaky gut syndrome. Chemical sensitivities reduce with a healed and improved gut relationship. Cholesterol reduction and improved HDL cholesterol is a side effect of taking colostrum. Colostrum has an antihypertensive effect. It actually contains ACE inhibitors that help balance blood sugar, blood pressure. And it has powerful antimicrobial activities. As a part of the Center for Nutritional Research, we were capable of, and we instituted a couple of studies related to AIDS in Africa and in India. And we had a very interesting process of seeing that colostrum and PRPs, which are the peptides in colostrum, that are the cellular communicators in colostrum to all of our cellular system, we saw an elimination of all the host infections with stage 4 HIV patients. We saw an elimination of all the diarrhea. We saw a regeneration of homeostasis in the gastrointestinal tract. So it provides incredible benefits. The PRPs that are in colostrum, also called clostrinin, have been tested and shown to reduce the symptoms of Alzheimer's and dementia. They've also been able to delay the onset, and these have been published in medical journals. Sovereign Laboratories back at booth 747, 7047 has an article on Alzheimer's and dementia if you want to stop by the booth and take a look at that. The Lactoferrin and Colostrum is unique. It's GRAS approved. It has the ability to destroy every virus it's come into contact with on contact in circulating in the blood. It's very, very beneficial for herpes and hepatitis and all kinds of viral infections to help the body provide natural defense systems that are very powerful. Colostrum has been put into studies in relationship to flu and compared to flu vaccine and been found to be 3 to 4 times more effective than vaccines in upper respiratory illnesses, even in the case of renal patients. Colostrum's immunoglobulins have a capability of binding to pathogens and carrying them out of the gut, have all types of pathogens. Colostrum is also beneficial for colonizing and bringing the initial load of beneficial bacteria to the gut. This is our very first food of life. This is where we get our beneficial bacteria. And in fact, we found in clinical studies that beneficial bacteria won't colonize without adding colostrum to the program. Colostrum contains PRPs. I've mentioned the PRPs. These are signaling mechanisms that have the ability to decrease the production of free radicals. It improves or eliminates allergies, reduces pain and swelling and inflammation and autoimmune diseases. It increases permeability of skin vessels. It improves long-term memory and can slow and reverse symptoms. It increases mice, so very powerful study stimulation and leaky gut, the remodeling and maintaining of bone and repair fractures, healing of wounds, and the increasing collagen production is associated with the growth factors that are in colostrum. So we have a corpus of 100 known colostrum substances and say bioactive in it. So that there are in colostrum, we've heard all of them. The ones that we have look like we are mammals, our immune system operates in exactly the same manner. One thing that you might not know, but I'd like to make as an interesting side point, Dr. Jonas Salk discovered vaccines by utilizing bovine colostrum to treat polio in humans successfully. He found that there were living antibodies in bovine cow's colostrum for polio, even though cows did not come down with polio. So the cow has an incredible capability of producing antibodies to known pathogens of all kinds, even though the cow won't become affected with it. All colostrum's not equal. Colostrum that is available in the health food stores will have no growth factors in it, will have no lactoferrin in it, and no PRPs, and about half of the immunoglobulins that you'd find in raw fresh colostrum. Colostrum's processing is critical. At the Center for Nutritional Research, we've been responsible for investigating and instilling and developing the means to process colostrum to provide its shelf life. We have to dehydrate it in order to do that, or you wouldn't have it available, because we only get 1 milking per cow per gestation. So that's 1 milking a year of about 12 gallons of colostrum. And of course the calf has to get its portion or it would die. And so we have a limited supply of colostrum. We need to treat it gently. We dry it without heat, and when you do that, and you test it prior to processing and after processing for all of the major components. And so we're looking for colostrum that has the ability to give us exact percentages and bioactivity of proof via ELISA testing, etc., so that we know that bioactivity is standardized under GMP certification. And when you find a colostrum that provides that kind of benefit, then it can provide all of the benefits that we've been talking about here today. In other words, you can't heal the leaky gut if you don't have epidural and epithelial growth hormone in the colostrum. So we need to know that it's there. Secondarily, there's a liposomal delivery on colostrum that is very important for you to understand. When colostrum is expressed from the mammary cell in the breast as it's initially produced, it is expressed and pushed out of that cell like a bubble coming out of a clown's balloon, where you've seen the clowns take and twist and create a bubble, and if you pop that off, that represents the colostrum molecule now residing in the aqueous or water that is in the breast. And so raw, whole, fresh colostrum has a naturally occurring liposomal or cell membrane surface coating on it. When you dry colostrum, this molecule, this protective structure, is fractured, and it's no longer there to protect the colostrum. So it's critical that we put it back on. What does the liposomal delivery do? A liposomal delivery has the capability to prevent oxidization of colostrum in storage and transit. It'll allow it to have a shelf life of many, many years. It provides the capability of the colostrum to survive the GI transit intact. If you take colostrum and put it in a beaker of stomach acids comparable to our normal stomach acids and give a 20-minute wait, we can go back and look at these components and find that most of them are gone. They're destroyed. So colostrum should be taken on an empty stomach, and it should be taken with water. Now, I know Dr. Keach had a lecture here yesterday about colostrum, and he says it's fine to take it any time with food, etc. I've worked with colostrum for 25 years. A chapter of his book is designated and donated to me. That book that he wrote was dedicated to the work that I did on colostrum. His plant was built at my specifications to provide colostrum under the specifications that the center brought to Dr. Keach. And I've worked hand on hand with thousands and thousands of physicians in all kinds of protocols, and worked specifically with their patients and the doctors, taking observations about the type of colostrum, how to administer it, and what works best. And so we found that putting it on an empty stomach enhances the viability and the survivability of colostrum into the small intestine. 2/3 of your immune function is in the small intestine. That's why it's so critical to get it down there intact. Now we have our PRPs that we have developed protocols in using PRP oral sprays, and the reason we put them into an oral spray and a concentration of those peptides is because when you were born, how'd you get your colostrum? You suckled your mother's breast. And in that suckling action, it was the actual physical action of suckling. The peptides, which are very teeny and very fragile, enter the body directly through sublingually into the bloodstream in seconds. They're not designed to go down through the digestive system. And so when we extract these and put them into an oral spray, we can mimic that kind of delivery. We can put them in a fresh, clean mouth, and we can absorb those, and we can absorb them into the bloodstream. The peptides are absolutely incredible. We have the Viralox peptide that Sovereign Labs has been put into clinical trials with preschool children, and we saw an elimination of 85% of the upper respiratory infections with just the peptide use alone. Now, we get down into the last part of this, and the antibiotic crisis that we're looking at basically is leading us, as I mentioned, to the fact that we've got various ongoing pathogens in our gut at all times, and the antibiotic use and abuse of antibiotics in our food supply is endemic in the United States. 2 days ago, the FDA announced a voluntary program with farmers in the United States and corporate farms to begin limiting the use of antibiotics. It's voluntary, folks. It's not going to happen. In Europe, antibiotics are barred from use in animal farming situations. It's something we need to do here, but it certainly will not eliminate all of the leaky gut process. So what I'd like to challenge you to do in your practice, if you take colostrum, especially the powder, and I recommend you use about 10 grams a day on a minimum basis, split that up into 2 divisions, one in the morning when you wake up, and one just before you go to bed, because the growth factors in colostrum work best during sleep. And then it has about an 8-hour shelf life. So you want, or body life, and so taking it twice a day is important. The sprays, the peptide sprays, can be used 2 to 4 times a day. Any more than that, and you're wasting the product. The peptides have a capability also of balancing immune function, and the peptide 3s that are in colostrum, it's a very specific size of the peptides, has an ability to bring the body's immune system back into balance, help stop the production of IgEs and histamines so we can stop the body from destroying its own tissue. So if we heal the leaky gut, stop the passover of large molecule proteins into the bloodstream, and then institute an immune response modulator that Sovereign Laboratories has developed that balances the body's immune system and stops the destruction of our own body tissue, then we have a chance for the growth factors in colostrum to come back in and provide nutrition to rebuild tissue in the body that has been damaged through this whole process. You can't rebuild damaged tissue. Let's talk about athletes. If you go out and work the body real hard through an athletic endeavor, you damage your muscle. We all know that. In order to rebuild muscle, we don't need just protein. We have to have a good nutritional source of protein, but we have to have growth hormone. And the older we get, the less growth hormone we produce. You all know that story, okay? We advocate at the Center for the introduction and use of bovine colostrum rather than hormone injections for a couple of reasons. We have all of the growth hormones in colostrum, not an isolated hormone that has the risk of cancer associated with it. And so colostrum is very anti-canceral, provides the capability to rebuild body tissue, provides the ability to provide the exact hormones, all of them, that are responsible for all of the tissue of our body. And so when we stop leaky gut, bring the immune system back into balance with the IRM peptides, immune modulation, then the colostrum growth factors can work with proper nutritional guidance that you'll be providing your patients, so that we're providing nutrition and the hormones to actually repair the tissue that's been damaged through this process. I'm going to open this up to any questions that you have.
Human milk is different than bovine.
Yes, yeah, it is. But let's have you understand that the differences are not in the molecules, it's in the amount of those molecules that are present. For example, human colostrum has a lot of IgA in it and lesser amounts of IgG. And the cow's colostrum has more IgG and less IgA. And this is because we get some of our immunity in the womb and the cow gets none. And the difference in the molecules are very simple. IgA has a hook on the tail on it. It's a Y-shaped molecule, it has a hook, and it can embed itself in the mucosal of the gut lining. And it can wait there while it fills up with pathogens, and then it'll detach and carry them out. The IgG doesn't have that hook, so its life in the body is the time it takes for gut passage. But also, the immunoglobulins are involved in transfer, immune transfer, and so they are the antibodies they carry the antibodies for most of the disease. And the reason that we have more IgG in the cow is because we have all of the immune transfer taking place through the colostrum, and not some of it. So. But we have in colostrum LD there's about 2.5% IgA in that colostrum, in colostrum LD. Yes. The effect on stem cells is the question. Colostrum has been shown that it will initiate stem cell production and differentiation. It initiates RNA and DNA repair. It's involved in that process from the very beginning of life. And so it has the capability of stimulating proper growth. And what's that?
Mobilizes?
Yes, it mobilizes.
How?
We don't know all of the mechanisms of colostrum because we don't have an understanding of all of the components of colostrum yet. This is something we're continuing to research. If you'd like, when you pick up these documents, we have an email address for me on the back The handout that's Y Sovereign Laboratories, there's an email address for me. If you have any questions about protocol use and patient use, send me an email. I'd be happy to work with you on that. But I also have something else. There's a website on the back of this. It's colostrumtherapy.com, and that's for physicians. And when you register and enter into that site, we have a list of the components that have been examined and discovered during colostrum. If you really want to get into understanding colostrum, you have to look at what's in colostrum and what do they do. And so we've compiled all of those. And it's by no means exclusive, because we're very new into really understanding colostrum. I want to explain why that's the case. We didn't know anything about our immune system prior to AIDS rearing its ugly head. We knew nothing. So we're still in the dark ages and about that. But in understanding colostrum and understanding AIDS and understanding the immune system, we tore apart colostrum, looking at all of its components. There's interleukins and there's interferons. All of them are in colostrum. All of them. Where do you think the drug companies found these components? They found them in colostrum. And then they isolate them. They recombinantly manufacture these components as antivirals. They are not 100% bioidentical, where the components in bovine colostrum are 100% bioidentical. I talked a little bit back about AIDS research that we'd done. We took stage 4 HIV patients. It's not the AIDS that kills you. The AIDS has the ability to make the immune system less effective. So it's the host infections that kill people with AIDS. And when we administered colostrum on a continual basis, and along with the PRPs, after 30 days we went back and we had an elimination of all the host infections. Continually taking colostrum, Well, we had when you take a look at the host infections that are associated with AIDS, we know that we've got all of the gastrointestinal infections running because we're having wasting disease. You can't uptake nutrition at all. Yeah, so, right. And so we can destroy all the gut-based pathogens. Colostrum and PRPs has an ability to go in and identify the cells that are infected with HIV and make them rear up their flags so that the immune system can identify them. And the peptides in colostrum has the ability to stimulate a 400% increase in natural killer cell activity, so that instead of about 8 cells that it can take out of the body, it can take anywhere from 20 to 40. So that effectiveness allowed the colostrum to go in and eliminate the host infections. Now, the other thing we saw is a normalization of CD4 counts and T cell counts after 30 days of use. And so the viral load was gone. We couldn't find the viral load either. Now, I'm not saying that cured AIDS. I'm not saying that. I am saying that it got the body's immune system to do the job that it was supposed to do. And that's what colostrum does, folks. That's what you have to understand. And here's another thing, is colostrum is very, very safe. All of the components that are in colostrum are normally in your blood serum already. We just produce less of them, and we have an imbalance of these things because of the things that we nutritionally intake, and the exposures to chemicals and alcohol and all of the other things, and medications and steroids, and the list goes on, and you know them all, okay? And so one of the things, if we're going to deal with that I find it's very important to understand, is that when 7 out of 10 patients going to a doctor today are going to go because of irritable bowel syndrome and gastrointestinal distress. 7 out of 10. And most of these people, 80% of them, are going to refer it on to a specialist. They're going to refer it to a GI doc, and the GI doc's going to probably put them on steroids. And steroids destroy gut tissue. You don't want to do that. You want to put them on colostrum. And we want to get them off of the things that create leaky gut. So they need a change in their diet. They need a change in their lifestyle. You need to get the alcohol and the sodas and the coffee minimized. You need to get them off the pain medications. You need to get them into a basis of where we're creating the body's, eliminate the cause factors and get back into the homeostasis that's naturally and desperately needed. Every one of your patients, anybody walking in the door in your offices with a chronic situation, you start them on colostrum, you're going to see very significant benefits. I'd like to ask my very, very dear friend, Aubrey Mickle, if she'll come up and just give you a little bit of information about her patient experience with colostrum. and with the PRPs. Would you come up and say hi, Audrey? I hate to put you on the spot, but I wanted to do this because I want you to be extemporaneous.
Hi. Oh, you're welcome. You're welcome. I am in love with this product. I use it personally. I put almost every single one of my patients on the product because I've had such phenomenal results with it. Everything from severe leaky gut syndrome to people who are recovering from chemotherapy to autoimmune. Everyone with an autoimmune process goes on colostrum. I had one patient who was just treated with, went through chemotherapy for a lymphoma. After the chemotherapy, had a bone marrow transplant, wiped out his immune system, came to me, developed type 2 diabetes. In the office, I said, try some colostrum. He was also, his body was covered with shingles. He was in severe pain. He was a mess. I gave him 2 teaspoons of colostrum powder in a little bit of water. He drank it, and he sat there, and his eyes got really wide, and he said, something is happening. I can feel this. Tell me more. And he said, I can just feel my energy is lifting, and I can think clear. This is just 5 minutes. Now, I know that sounds incredulous. I know, I was there. He took the colostrum. He's reporting he is feeling so much better now. He's on, the only other supplement he's taking right now is some vitamin D, and he's drinking 12 ounces of fresh vegetables every day, and he is feeling better, doing better. Now the shingles haven't resolved yet, but he's in process. I've had a number of cases with Hashimoto's thyroiditis, helping the process, and autoimmune. It is. Yeah. I think it could definitely help Alzheimer's. I have a patient. Yeah.
I'm gonna have to wrap this up because we ran over our allotted time.